Hello, my name is Ro. I'm a student nurse, and today we're going to be working our first patient, and it's going to be the doctor's orders to insert a straight catheter to check for PVR, which is post-voidal void residual, times 1 now. So this is my patient here. First, I'm going to identify myself to the patient, make sure my hands are clean, and I'm going to identify the patient, ask him or their first and last name, date of birth. I'm gonna have them reiterate that. It's back to me, and I'm also gonna check their wristband to make sure that I also have the correct patient. So we're gonna get started. So I'm gonna open the kit away from us. I'm gonna take out the gloves, 1-inch waters. Open up the center. So it's backwards, I'm just going to turn it around. Now I'm a left-handed person, so I'm going to grab with my right hand the inner cuff, and I'm going to put them on away from me, and away from the area I'm going to be working on. Make sure not to pull too hard, and to always be playing around the inner cuff and outer. Okay, this is the best I'm going to get it on right now. Now I'm going to grab on the inside of the cuff from my right hand. I'm going to try to gently squeeze in my right hand. Okay, now with my right hand I'm going to fix my left hand glove. Not breaking sterility. There we go, all set. Keep hands above. We're going to discard. Always hands above waist. So my whole kit is sterile. What I'm going to do now, we are not obtaining a sample, so I'm going to push this off to the side. We have here the drape. So everything's sterile, my gloves are sterile, so I could touch everything here. So I'm going to place this over my patient. Next here, I'm going to place the shiny part down here. This is going to go there in between my patient. Next here, I have the catheter inside. I also have lubricant, and I also have the cleaning swabs. So what I'm going to do now is fill this. This is all sterile. I'm going to push them all to one side. I'm going to open it. I'm going to push them over to the other side so I'm not messing them around. Okay, so this is garbage. Push it aside. So I'm going to take out, now since this is sterile, I could place this right here. Alright, so I'm going to keep that right there for right now. I am going to have the lubricant here in my hand. I have the catheter here, straight cap here. What I'm going to do is I'm going to have this already prepared and open for me. So I'm going to open up the side, and I'm going to place it on the side here, so when I'm ready I can lube up my catheter. So place all of that there. Now this is garbage above waist. Now my catheter is in there waiting. Now I'm going to be cleaning. So I'm going to take out one cotton swab. I'm going to be cleaning here. I'm going to grab, I have a male patient, so I'm going to grab here. In the beginning of the meatus, I'm going to cleanse the area, so I'm going to go around in circles. 1, 2, 3, and also at the same time I'm going to be turning the cotton swab. Right, so I can be getting clean areas on my swab. Clean. I'm going to be discarding. I'm going to get the other one. Now we're going to be doing the same thing. Clean, go a little further, rotating it. Clean, 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 clean. Discard. I'm going to get the last one. I'm also going to be cleaning the area. Clean, clean, turn, 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 turn. Make sure the area is clean before insertion. So I gave up one hand, so it's not sterile. I only have one hand that's sterile. This is also trash. My trash is over there, but for right now, time being, because this is all going to be thrown out, I'm going to keep everything right here. Now I'm going to get I'm going to move my whole tray over here, so I'm not stretching around. This hand's sterile, so I'm going to make sure I have it right here. Now I'm going to dip the the beginning of the catheter in the loop, at least get this much in, because for a male, it's going to go in about 8 to 12 inches. I'm going to go in, and now I'm going to slowly insert, make sure my hand does not touch the meatus. And we're going in. Let me fix that up there. I'm going to go in. So we're checking for PVR. So the whole time I'm going to hold it, wait a couple seconds, see if there's any remaining fluid or urine inside of the bladder. And there's no sample being collected, so that's fine. So we're going to collect it into this tray. Now, once we're all set here, I'm going to have him distract him real quick, say whatever you want to say, but if you want to, and then once it's time to release, be like, oh, okay, can you blow out the birthday candles? We're going to take it out. Now, everything here is going to be discarded. There's no need for this anymore. So now I'm going to have this, take off my gloves. I'm going to pinch in. Hands a little sweaty. I'm going to pinch in, off here, roll up, take off, and now this is garbage. So I'm going to dispose over here. So this is how we do check for PVR straight cap. Now we have here in our doctor's order, we have my patient is experiencing dyspnea, which is difficulty breathing or labor breathing. So it's tough for the patient. So I noticed my patient's a 70-year-old Caucasian woman. Her complaint is that she has shortness of breath for the past 2 weeks. First here, what I will be doing, my assessments I will be assessing for the lungs and chest. I will be looking for nonverbal signs of pain. I will also check for the use of accessory muscles. I will make sure to check the posture of the patient because it's much easier for the patient to breathe when their back is straight, more space for the lungs to expand, not hunch over. I will also be assessing for a mental health assessment on the patient, because if they're having a hard time breathing, they could also be getting lack of air to their brain, which could lead to hypoxia. So mental health assessment is always important. Next here, we have the equipment I'll be expecting to use. So since this might be a respiratory issue, so we may have some respiratory equipment here with us. I would have a stethoscope to check for lung sounds to make sure that they appear close to normal limits. I would have a numerical scale to test for pain and discomfort from 1 to 10. To test for vitals, I would have a BP cuff and a pulse oximeter. I will also have TriFlow, which is to help expand the lungs so that the diffusion in alveoli between oxygen and carbon dioxide is efficient, to help practice with that. And I will also, depending on the doctor's order after my assessment and my recommendations, depending on my doctor's order, I will need a certain amount of oxygen given to my patient, so I will need an oxygen meter on the wall to make sure that's working properly, and also for room air, just in case. I will have a O2 meter. I will have nasal cannula, just in case we're going to be giving oxygen via that method. And just in case if they're respiratory distress and it's severe, I will have a non-rebreather just in case. And depending on the certain amount of liters, so if it's either 4 or above 4 liters, I'm going to need a humidifier. But when you're using a non-rebreather, you're not going to need that because we're more worried about them getting oxygen than their comfort. So that'll be the equipment I'll be using here. I checked their vitals. Her temperature is 80 degrees. Her heart rate is 82. Her respiratory rate is 28. Her blood pressure is 157/64, and her oxygen saturation is 86 on room air. So with those vitals, some came up to my attention: heart rate, temperature, blood pressure, and O2. But since she's having problems breathing, it will be oxygen and respiratory rate that we'll really focus on. But so now I'm going to be talking to the doctor through SBAR. So I'm going to introduce myself to the doctor. My name is Raul. I'm the nurse that's monitoring Mrs. Jones, who's a 74-year-old Caucasian woman who's been experiencing just dyspnea, difficulty breathing, labor breathing. And my evidence with this is through her vital signs that I had taken personally. I am concerned with her respiratory rate, which is over 20. It is over 20, and her O2 saturation, which is at 86, and normal is between 94, 95 to 100. And also, so with that, I'm concluding that she's in respiratory distress. Patient is also showing me signs of cyanosis around her fingertips and around her lips. And I also noticed the use of accessory muscles. And that's my assessment. I'm going to be requesting and recommending an order of O2 through nasal cannula. And if it gets worse, I would be switching to a non-rebreather mask to help her more with the respiratory distress. While doing all of this, I'm going to make sure I let the doctor know that I'm going to be monitoring the vital signs every 20 minutes, making sure that the oxygen is working efficiently, and that to see our patient is slowly getting out of respiratory distress. So I will be documenting throughout this whole thing and making note of it. But subjective, I will be using the SOAP method. So subjective, I would know everything that the patient's feeling from when things started till now. And I noticed that it was going to be from the past 2 weeks, she's been experiencing shortness of breath. Whenever she would go on walks or if she's going up the steps to her bedroom. She has no pain. She just notices that she needs to take a quick break to sit down to catch her breath. For objective, I would list down here her vital signs, which is temperature was 80 degrees, her heart rate was 82, respiratory rate was 28, her blood pressure is 157/64, and her O2 sat was 86 on room air. Also, I would note that she's a 74-year-old female, Caucasian woman, no pain, she's not taking medications. And I also, while having conversation with her, I noticed she takes short breaths while talking to me, and she has to take a sit down, and then she can take it from there once she catches her breath. My assessment is going to be respiratory distress, evidenced by her vital signs, her O2, respiratory rate, and blood pressure. Also, the signs of cyanosis around fingertips and lips, and the use of her accessory muscles. My plan is to notify the doctor and her PCP in the change in respiratory status. I'm also going to request O2 for the patient. Once the doctor meets with her, he'll give me a specific amount of O2 so that the patient could start breathing comfortably and be reaching her O2 saturation to reach it above a 94 so that we're comfortable and that she's also comfortable. My interventions, so the doctor ordered 4 liters of O2 via nasal cannula. So I'll get all my equipment prepared. The order's for 4 liters, so I noticed that I'm going to need a humidifier for my patient. So I will be using that, attach that to the breathing tube, to the nasal cannula, and I will help my patient go into high fowlers, which will help her sit upright so she gets an expansion of her lungs. I will also try to go over with the patient to try to use diaphragmatic breathing, and to also, when she's breathing, to purse her lips, and I will be monitoring my patient every 20 minutes to make sure that everything is working efficiently and that oxygen is helping her. My evaluation over everything, I use my interventions to help my patient breathe better and more comfortably. Monitoring my patient every 20 minutes, and I noticed that the patient's respiratory rate changed from a 28 to an 18, which means it falls into normal limits. I also took the patient's pulse-ox, and it measured a 96 O2 saturation. So I'll make note that this is their O2 saturation is a 96 on 4 liters nasal cannula using a humidifier.